Hello, I'm Zahi Fayad. I'm the director of the Biomedical Engineering and Imaging Institute at Mount Sinai. I'm joined here by my dear colleague and friend, Thomas Fuchs, who's the chair of the Department of AI and Human Health. So we're here at the Aspen Ideas in a beautiful setting, beautiful mountain, great sun, so feel jealous for us. So I wanted to talk to you about a great conversation we had this morning at breakfast to discuss what's going on and exciting at Mount Sinai in the space of AI, in the space of digital health and next technology. So Thomas, let's talk now. We have this conversation about what's going on in your field of AI. Where are we today in the different disciplines of AI, and where are we heading in the near future?
Yeah, thank you, Zahi. It's a fantastic location to actually talk about the future of healthcare, and AI will certainly be an important part of it in all elements of it. And at Mount Sinai, we have the chance to really build AI at very large scale. So we have large compute infrastructure. We have a lot of data from a very meaningful population, a very diverse population. Right. So we can actually build systems that are very large and very deep, that truly understands, for example, the source of disease. In pathology, we use them to detect cancer or grade cancer. And newer models, for example, are used to actually predict outcomes. So these are computational biomarkers based on AI, which is a very exciting development in that field that we try to drive forward. But that's actually all when you are already sick and in the hospital, right? I know you do great work for patients or non-patients before they actually come into the hospital.
Exactly, yeah. So we're obviously interested in helping people who are sick, who have chronic diseases or diseases such as cardiovascular disease, cancer, autoimmune diseases, etc. But obviously we need to help people avoid getting the disease. And we're trying to use current technology that includes, let's say, screening with imaging methodology that's very precise, but also equip people with wearables that can be embedded in your body that can measure these physiological signals and tell us diseases as they occur 24 hours. So this is an incredible tool to help improve somebody's health over the lifespan, so from maybe the time you are born all the way as you get older, but also to help the human performance, to live longer, but to live very healthy. So that's why I'm very excited about these wearables. But these wearables obviously are going to need to have some engine to process the data. And this is where we come in our collaboration with you and your group in terms of AI. So can we talk a little bit about that? You know, how we integrate these predictive models and analytics into these multimodal data that we are acquiring?
Yes, so you're hitting a very important point. So in the past, medicine and also AI in medicine was very much siloed into various areas. You talked about variables or radiology, pathology, oncology, and so forth. What we try at Mount Sinai, your group, our group, and a lot of collaborators, is to build these large multimodal systems that really take a more holistic view of the patient and give the physician also holistic information about the patient to make better decisions for the individual, but also for the whole health systems.
Exactly.
And seeing AI infused in all these areas for the benefit of patients is really very rewarding. And so one thing that's really very dear to my heart and also to yours, I know, that is that AI can be used to democratize access to healthcare. Right? Not everybody can afford to go to Mount Sinai, but if you build these fabulous systems, you can then apply them in all kinds of community clinics and also in the rest of the world and give patients access to, for example, computational diagnostics or biomarkers they would not have had otherwise. And I know that's the same is true in your case from the radiology side and the wearable side. Right?
Absolutely. So we're seeing a couple of things here, in a sense, to make the healthcare access more accessible and wider.
Yes.
Not that you need to come to visit this hospital that's located in Manhattan or in different places, but now we can reach out to these maybe difficult communities to access, etc. So how do we do this today? So we see this with these wearables. These wearables are cheap, they're easily deployable, and more they're gonna get cheaper, and you can scale them up. So that's number one. The second part is these expensive imaging systems that usually are in the basement of the hospital, where you're spending millions of dollars to site them, millions of dollars to buy them, they actually are a barrier to delivery of healthcare. So now we are taking advantage of novel image reconstruction techniques. So it means that you can take a low-cost imaging system where the hardware may not be at its optimal, but you are recovering and you're improving the hardware by using software and AI with image reconstruction. So that is an incredible, I would say, advancement and innovation that's going to have wonderful impact to the field. So we have a couple of minutes or maybe 1 minute left here. So why don't you maybe in 30 seconds, finish with something exciting that we want to tell the audience, and I'll finish and I'll wrap it up in the next 30.
Yeah, of course. Okay. So we talked a lot about the present and also the past.
Yeah.
But we are really just at the beginning of this revolution of AI in healthcare, in all these areas. So the next 5-10 years and beyond that will be enormously exciting. And we see that impact with the first FDA-approved systems, for example, in pathology. Right? The first time AI can be used to help patients practically in very difficult cancer diagnostics, for example. And if you look further into the future, and you will have that applied throughout a plethora of disease, the care will get so much better. In a lot of cases, it will get actually much cheaper, like you said, with cheaper devices, or also with early detection, because you can increase access for a larger population with these tools. So I'm very, very excited about the next 5-10 years, and I'm very excited to do that at Mount Sinai, where we have the means to drive that forward.
Exactly right. I mean, I'm excited about the aspect of how principles of engineering are fully now getting integrated within medicine. I really see us playing an incredible role to get that revolution and to get that into delivery to people, making them healthy, making them live a long time, and also maybe improving their performance in terms of mental performance, physical performance, and living happy. So with this, I'd like to thank the audience for listening to us in this beautiful setting. We are really grateful to be here and to be supported by incredible people and to be with my colleague, Thomas Fuchs. Thank you so much.
Thank you.